So, how is your experience and observation in a final cancer state? Do you have to change the remedies very often, the dose, and how do you act with the time pressure?
It depends from case to case.
Mm-hmm.
Let us talk about the very terminal case. Let us talk about the dying case.
Yeah.
With multiple metastases and who have had all the therapies and now left to die. Well, we still talk about soothing palliation in these cases. These cases, most of the time, do not need constitutional remedy. You will be surprised to know this.
Mm-hmm.
These cases, most of the time, need clinical remedies, short-acting remedies for palliation of very troublesome symptoms. They want peaceful death. And wherever possible, peaceful prolongation of the lifespan, comfortable life. This we achieve mostly with organ remedies, and I also call them cancer remedies.
Yeah.
And we have worked with them a lot. We give them in homeopathic doses. We give them strictly according to the Hahnemannian principles. We use the mother tinctures at the end stages, and these mother tinctures also become a simile-mum for them. Many times tincture becomes simile-mum because the pathology is so gross and so advanced. We have to meet the picture of the remedy with the picture of the advanced pathology. And here, many a times we have seen giving a deep-acting constitutional remedy creates a lot of problems. So we have to be very careful. And our experience is to work with organ remedies, clinical remedies, in low potencies, often repeating, often changing. The picture changes every hour, the picture changes every day, and the remedy keeps changing.
But you're still stuck on the patients, on the repertory, on the organon, and on the philosophy.
Yes, that is our basic.
Yeah.
And we cannot deviate from the basic. Yeah. And that is what I want to teach. That is what I want to tell my colleagues. Look, we must work. We must work with these remedies. And many of the remedies are not new. They are from Hahnemann's time. Hahnemann worked with them. Bonninghausen worked with them. Boger worked with them.
So tell us some common cancer remedies, please.
Yes, but it's
some really.
Also.
I know there are hundreds of, but tell us some really strong.
Okay. One of the important remedy in the present times is cadmium sulfuricum, which we use a lot. A grand remedy, which we use in the 6C and 30C potency, and it matches wonderfully well the last debilitating state of a cancer patient, especially patients who have had chemotherapy and radiotherapy. The vitality is totally gone like carbo-vegetables. The patient is debilitated, is vomiting, full of nausea and vomiting blood, the so-called coffee-colored vomiters. A wonderful remedy for patients who cannot tolerate chemotherapy. Rather they die during chemotherapy, they succumb. A wonderful remedy to bring them back. One of my favorite remedies for chemotherapy and radiotherapy. It gives energy, vitality. This is from the metal, from the chemicals, from the minerals, metals. And an important remedy in the polluting world of today. I can give you one more example from the vegetable kingdom. Cistus canadensis, a very important remedy which we often use for the glands in the neck which suppurate. Now, neck is one region where a lot of secondaries come. From liver, from lungs, and from so on and so forth. A grand remedy for cancers, either primary or even secondary when it comes to the neck, and start suppurating. A very chilly remedy from the vegetable kingdom. And so there are so many. And the organ remedy I would like to mention is Cardus marianus.
Yeah,
One of my favorite
for the liver.
remedies for the liver.
Yeah.
And the poor liver is always subject to more to the secondaries than to the primary hepatocellular carcinoma. And liver is involved in practically almost all of the cancers in the body. So Cardus Marianus is of a great help as a mother tincture. So I give you 3 examples: Cardus and mother tinctures, sisters from the vegetable kingdom, and cadmium cell from the metals and the minerals and the chemicals.
Mm-hmm.
And there are so many of them.
I know. So, in addition to homeopathy, what else do you recommend your patients in the clinic and in the hospital? What else do you find important, like food and exercising?
This is very important, very important, as important as the remedy.
Yeah.
So we basically try to talk with the patient and try to infuse some confidence in the patient. Look, you can fight with the disease. The fighting spirit is inside. This is what we impress upon the patient. It is ultimately the spirit inside, the vitality which has to help the patient and heal. So this is the first point. We always try to infuse confidence in the patient. Secondly, about the living. We advise the patient to live according to the nature.
Mm-hmm.
Has to be more near the nature. In a non-polluted open place. Live like what the nature expects from us. In a healthy atmosphere, with sun, with pure air. Then we ask the patient to eat a vegetarian diet. We absolutely ask them to leave flesh, not even eggs. We ask them to take a vegetarian diet because we believe that our intestines are meant for a vegetarian food. We need more of fibers and cellulose. And in cancer, we ask them to take a lot of soup, vegetable soup, lot of vegetables, gemüse, and also we ask them to cut down on milk products. We ask them to take a lot of water for the cleaning process, lot of water. Then we give them special yoga and pranayama courses. Pranayama is again a healthy healing, healthy respiration exercises which makes oxygen go to every alveoli of the lungs and gives you confidence. We ask them for meditation because meditation gives divine strength to the mind, to the thinking, and it has great power. So meditation, the yogic exercises, the pranayama, the vegetarian diet, and life, living according to nature. Meditation takes away many evils from the mind, like jealousy, like bad thinking, and that goes a long way in cancer healing. So, and along with them, the homeopathic remedies, that goes a long way even in these advanced cancers. Yeah.
So, this answer was so nice. I would have, even here on my paper, 1,000 different questions, and I know that the seminars you give, you can't do in one day. You have to really join and get into. So I thank you. I thank you that you recommend the classical Hahnemannian application of homeopathy.
Yes.
I thank you that you remain in the roots of homeopathy, and I thank you sharing the ideas about the treatment of cancer, and I wish you both good luck and God bless you for the future.
Thank you very much.
Maybe very shortly we appear in 3 generations. His one son is studying homeopathy, and shortly he will be a homeopath. So this will be a 4th generation's homeopathy dedicated to real classical homeopathy.
And this is what I wish you, that the roots come up and the strength and the experience and spread it out in the world.
Thank you
very much for the wonderful talk we
Yes.
had today and the wonderful questions you had. We must thank you for that. That they were so important. They were very, very important, and we feel satisfied the way you asked the things, and I think many, many people will be benefited by this. Thank you very much.
Thank you too. Good evening.
Thank you. Yeah.